I've stood on the front lines of emergency medicine for over 3 decades. I've seen the best and the worst that can happen to the human heart. And I need you to hear me clearly on this. Most people over 60 will not survive their first heart attack if they're alone. That's not fear-mongering. That's a statistical fact born of 3 decades of midnight shifts. Almost half of all heart attack deaths occur before the patient ever reaches the hospital. Why? Because those first, critical minutes are wasted in hesitation, denial, and panic. They don't know the simple, science-backed actions that can keep blood flowing and brain cells alive long enough for the sirens to arrive. The brutal truth is this: if you don't know these steps, you could be gone in minutes. I have seen it. Every single day, I've watched patients carried into my ER, good people, grandparents, retirees, whose outcomes would have been drastically different if they had performed 1 or 2 crucial actions at home. The story is often the same: a vice-like pressure in the chest, sudden breathlessness that feels like drowning on dry land, a cold sweat blooming from nowhere. And by the time they reach my doors, the golden window for intervention has slammed shut, leaving us to manage the irreversible damage. But here is the powerful, life-affirming news. There are proven techniques, simple actions you can perform right now, even if you are completely alone, that can double, even triple, your odds of walking out of the hospital. Not gimmicks, not internet myths. These are the real strategies cardiologists whisper to their families. In this video, I will walk you through the 7 life-saving steps every senior must memorize to survive a heart attack when nobody else is around. These are the very instructions I scribble on my heart, wishing every patient had practiced them before disaster struck. And wait until you hear step 3. It's so counterintuitive, yet research shows it can be the decisive factor between permanent disability and walking out of the hospital under your own power. Most people have no idea, but after today, you will. Before we begin, tell me one thing: how old are you? Put it in the comments. I read every single one and reply as if we're talking in my clinic. So, be honest. Now, let's start with step 7, the very first decision that charts the course between survival and tragedy. Step 7. Call emergency services immediately. Do not negotiate with denial. The instant you feel the sinister signs, a crushing or squeezing pain in the chest, often radiating to the jaw, neck, back, or left arm, sudden shortness of breath, nausea, lightheadedness, or that unexplained cold sweat, your only job is to call for help. Do not wait. Do not downplay it as probably just indigestion. Do not tell yourself you don't want to be a bother. In cardiology, we have a mantra: time is muscle. Every minute blood flow is blocked, a swath of your heart muscle dies, scarring forever. A study found that patients who activate EMS within the first 5 minutes of symptoms have survival rates up to 50% higher than those who delay. I remember a 68-year-old former teacher. He felt an odd tightness while reading the paper. He drank water, took an antacid, and waited for 3 hours, believing it would pass. By the time his wife found him gray and gasping, the major artery feeding his heart was 100% blocked. We worked on him for 45 minutes. If he had called the moment he felt that first twinge, we could have opened that artery with a stent, and he'd likely be enjoying his grandchildren today. That story haunts me because it is so preventable. Act as if it is a heart attack until proven otherwise. Making that call is the single greatest act of self-preservation. Step 6. Chew and aspirin, 325 milligrams, if available and not allergic. Once you've called 911, this is your next pharmaceutical defense. Chew, do not swallow whole. A heart attack is typically caused by a blood clot blocking a coronary artery. Aspirin is a powerful antiplatelet drug. It helps prevent that clot from growing larger, maintaining a trickle of blood flow. Chewing it dissolves the pill instantly, allowing the medicine to absorb through your mouth and stomach lining, reaching your bloodstream in minutes, not the 10 to 15 it takes for a swallowed pill to dissolve. A landmark study showed that early aspirin administration during a heart attack reduces mortality by 23%. I treated a 70-year-old retired bus driver who felt the elephant on his chest. He remembered this tip, chewed an aspirin while on the phone with dispatch. Later, the cardiologist noted the clot was friable, already breaking apart. That aspirin bought him the time his heart needed. Note: only do this if you are not allergic, have no history of bleeding disorders, or aren't on a doctor-prescribed blood thinner like warfarin. Keep an uncoated aspirin bottle in an obvious place: your nightstand, kitchen counter. Step 5. Loosen tight clothing and sit upright, back supported. In the terror of the moment, your body's position matters profoundly. Do not lie flat. Lying down increases the volume of blood returning to the heart, forcing your failing pump to work harder against a greater load. Instead, sit upright on a couch or chair, with your back supported and knees bent. Loosen any restrictive clothing, belts, waistbands, tight collars, bras. This reduces pressure on your diaphragm and lungs, making it easier to breathe and decreasing the heart's workload. Physiologically, this upright position minimizes pulmonary congestion, the buildup of fluid in the lungs that makes you feel like you're drowning. A 74-year-old patient of mine, a gardener, felt chest pressure and had the presence of mind to move to a patio chair, loosen her apron and belt, and sit upright. This simple act prevented her from fainting and allowed her to maintain conscious, controlled breathing until help arrived. Give your heart room to breathe. Step 4. Perform cough CPR only if you feel faint or lose consciousness. This is a specific, targeted maneuver, not something to do continuously. If you feel yourself fading, your vision tunneling, a wave of dizziness crashing over you, coughing forcefully and deeply can generate internal pressure that temporarily propels blood to your brain, keeping you conscious. It's called cough CPR. Take a deep breath in, then cough hard and long, as if you're trying to clear your lungs from deep within your chest. Repeat a deep cough every 2 to 3 seconds until the dizziness passes or help arrives. Research notes this can maintain cerebral perfusion for crucial extra moments. A 69-year-old mechanic I know survived because he used this technique when he started to black out alone in his garage. It bought him the 90 seconds he needed for his wife to find him. Remember, this is a bridge, not a treatment. Your goal is to stay conscious long enough for the defibrillator to arrive. Step 3. Unlock your door and keep your phone on speaker, clutched in your hand. This is the logistical step that saves lives. When you call 911, immediately unlock your front door. Paramedics are prepared to break it down, but that wastes 2 to 3 precious, golden minutes of cardiac muscle dying. Then, put your phone on speaker mode and place it on your chest or nearby. This allows you to communicate with the dispatcher without holding the phone, and if you do lose consciousness, they can hear you and guide responders directly to you. I lost a patient, a 73-year-old widower, because he collapsed before he could unlock his deadbolt. We heard him fall on the 911 call, but we were stuck outside, the sound of our own pounding fists mixing with the static on the line. Don't let a locked door be your final barrier. Make a clear path for your rescuers. Step 2. Practice pursed lip breathing to fight panic and oxygenate. Panic is a poison during a heart attack. It floods your system with adrenaline, spiking your heart rate and forcing your heart to demand more oxygen it simply cannot get. Combat this with controlled, diaphragmatic breathing. Inhale slowly and deeply through your nose for a count of 4, feeling your belly rise. Then, exhale even more slowly through pursed lips, like you're blowing out a candle, for a count of 6. This does 2 things. It maximizes oxygen exchange in your struggling lungs, and it activates your parasympathetic nervous system, the body's brake, lowering your heart rate and blood pressure. A 76-year-old retired nurse survived her massive heart attack by focusing solely on this rhythm of breath, keeping her mind anchored and her body as stable as possible until we could take over. Step 1. Become a statue. Stillness is your superpower. Your final and most critical instruction: minimize all movement. Do not try to walk to the door. Do not pace. Do not go look for your insurance card. Any physical exertion increases the metabolic demand on your heart dramatically, accelerating the death of oxygen-starved muscle cells. Your goal is to be found calm, still, and breathing, having done everything you can from your seated position. Studies confirm that patients who remain still have smaller infarcts, areas of dead tissue, and better recovery outcomes. I think of a 71-year-old farmer who felt the pain while on a ladder. He didn't try to climb down, he sat on the rung, called 911, and waited. That decision saved his life. Conserve every single ounce of energy for the one task that matters, keeping your heart alive until the experts are at your side. And there you have it. The 7-part protocol that can mean the difference between being a statistic and being a survivor. From the instant you dial to the moment you hear the paramedics call your name, these steps form a chain of survival you control. Now, I need you to do something for me. First, share this information with someone you love over 60. This knowledge is too critical to keep to yourself. Second, tell me in the comments, do you have an aspirin in the house? Is your door easy to unlock in an emergency? Your answer might prompt someone else to take action. This isn't about views, it's about building an army of prepared seniors. Your knowledge is your power. Your calmness is your weapon. And after 60, being prepared isn't just smart, it's everything. Stay safe. We're all in this together.